And the next session is going to be by Professor S.K. M.K. Herapathdeniya, Head Department of Ayurveda Pharmacology, Pharmaceutics and Community Medicine, Faculty of Indigenous Medicine, University of Colombo. And she has done MD in Rasashastra from Banaras Hindu University, Varanasi, India, and currently pursuing her PhD from the University of Kelaniya, Sri Lanka. With her enormous experience in the field of academics, research in Rasashastra, she would be presenting the topic of safety and efficacy of Ayurveda Rasaushadhi. Over to you, ma'am.
Good afternoon, respected chairperson, co-chairpersons, respected professors, delegates from India and Sri Lanka, officers from Department of Ayurveda, all respected invitees. My topic is safety and efficacy of Ayurveda preparation. I think in Professor Parnagama Madam's presentation, we all get some idea how to prepare a quality rasa preparation. But after preparation of this Rasaushadhi, we have to know how we can safely introduce this preparation to the human. Rasashastra is the main branch of Ayurveda pharmaceutics. We know we use herbal, metal and minerals for our drug preparations. But herbal preparation always we discuss, because most of our preparations prepared by using herbal. But we have to consider especially about how we use these metals and minerals for our diseases. For different preparations, how we efficaciously and safely use for different conditions. That in Rasashastra is the branch which explain all these metals and minerals how safely used for different disorders. Actually, in our previous presentation, Priyani Madam correctly told these metals, minerals and these herbo-mineral, all these preparation considered as Rasaushadhis. Why? We all several times discussed why all these metals and minerals preparations are superior, because we use in this preparation in very tiny dose, and these preparations not giving any unpleasant taste. That means these preparations are very palatability, and its shelf life also having long shelf life, and efficacy, it's having good efficacy. So that's why we considered these Rasaushadhis are more superior preparation than herbal preparations. But we have to know all these metals and minerals are heavily toxic. So how we can convert these toxic materials into non-toxic pharmaceutical condition? Yes. Now globally there are very serious questions arise for the Rasaushadhi, because these Rasaushadhis contain severe toxic materials like mercury. That's why always they raise questions, how you give this preparation to the human being. We face many problems, especially indicate this rasa preparation for different disorders. But we know all these preparation used from thousands of years from our Ayurveda physicians. But what is the secret between this preparation mean? In Rasashastra followed different processing techniques to prepare these materials into non-toxic form. Always, Ayurveda, we not consider about the curing of the disease. Always we have to preserve, or we have to prevent the disease. It is the most valuable thing. Prevention is, I think, in Swasthasya Rakshana is more valuable than the curation of the diseases. So that's why this rasa preparation we can use for preventive and curative and also for the rejuvenative actions. Always when after preparation of this Rasaushadhi, we have to ensure the safe use of this product, and we always try to avoid the occurrence of unwanted effects to the patients. It provides information on possible health hazards likely to be avoided from repeated drugs over a limited period of time. And also, we have to ensure this safety of this study, always we use toxicity study. For this toxicity study, initially we use different animals. We can use rats, rabbits, and for monkeys. For in this studies, very simply we can use rodents because then after we can progress these toxicity studies to a clinical trial after when we complete the toxicity part. In this study, especially I'll give you attention regarding the toxicity of Lokanath Rasa, because this study we not completed yet. This is also ongoing research. Already we completed the standardization part of this preparation, and also some antioxidant effect and anti-inflammatory studies already we completed, and toxicity study also completed. We have to do a clinical trial for this preparation. This Lokanath Rasa also a mercurial preparation. It is categorized under a Potali Kalpana. Parangam madam told there are 4 types of preparation mentioned in Rasashastra. Among these 4 preparation, this Lokanath Rasa comes under Potali preparation. It's a special preparation mentioned in Rasashastra. These are the ingredients of Lokanath Rasa. It contains Shuddha Parada, Shuddha Gandhaka, and equal amount of Shuddha Parada and Gandhaka convert into a Kajjali, and 2 parts of Abraka Bhashma, 2 parts of Lauha Bhashma, and 2 parts of Tamra Bhashma, and 6 parts of Varatika Bhashma include in this preparation. After preparation of Kajjali, all these Bhashmas mixed together with Kajjali, and then this mixture bhavana with 7 days bhavana with beetle juice, and then subject it to Sarava Samputa, and finally give to Gajaputa, and we can obtain Lokanath Rasa. It's of ash color, very fine powder. The recommended dose for this preparation is 2 to 3 Rattika, and it is we prepared this Lokanath Rasa according to Rasendra Sara Sangraha. If you go through Rasashastra text, there are many Lokanath Rasa preparation mentioned in Rasashastra text, but we selected this Rasendra Sara Sangraha Priha Roga Adhikara reference, and this preparation mentioned in Ayurveda Pharmacopoeia also. Then we selected the topic hepatoprotective activity of Lokanath Rasa with special reference on hepatocellular carcinoma. This project funded by the United Nations Industrial Development, UNIDO Geneva, government of Switzerland, through Ministry of Environment, we got the grant. And this is the study design for this preparation, because I'll come to the safety study. Before come to the safety study, I'll briefly mention the study design. First, the preparation and analyze the physicochemical parameters of this preparation, and then safety evaluation, acute and chronic toxicity studies, then evaluation of in vitro antioxidant and anti-inflammatory activity, 4th, evaluation of the anti-carcinogenic activity of Lokanath Rasa by using hepatocellular carcinoma cell line. Finally, clinical assess to assess the effectiveness of Lokanath Rasa for non-alcoholic fatty liver disease. Here, now I'll describe how we conduct the toxicity study of this preparation. Even before start the animal studies, we have to get the ethical clearance. We got the ethical clearance from University of Herapathdeniya Postgraduate Institute of Science. Here I selected male and female viscerats. Their weight between 150 to 200 grams. 6 weeks old rats I selected. We purchased this rat from MRI, and the oral toxicity study was performed accordance with the Organization for Economic Cooperation and Development. Here young, healthy, non-pregnant male and female rats. We we randomly selected, and 6 animals in the one group, 5 groups we used for this study. Then each group of rats are separately housed in a polypropylene cage in ventilated room, ambient temperature 22 centigrade, relative humidity 40 to 65%, and light 12 hours dark, 12 hours light photo period, and they were provided with rodent food and purified water. All the animals acclimatized to the laboratory condition at least for 7 days prior for the experimentation. I conducted this animal toxicity study in Faculty of Medicine, University of Ruhuna. Here study group, in one group there are 6 animals. The dose for the acute toxicity I gave 200 milligram per kg body weight by using oral gavage, and animals were closely observed initially every 4 hours within 24 hours for acute toxicity. But no observation of treatment related death or toxic signs, lacrimation, lethargy or abnormal respiratory pattern, salivation or chronic or tonic movements are not observed within these 24 hours. Then the repeated dose, the chronic oral toxicity study I conducted, because always we prescribed these rasa preparation in a very short period, but I done this chronic toxicity study for 90 days. Continuously I induce this drug for 90 days. Here study group 30 rats, and these rats also different doses I introduced to this rat 90 days continuously. I gave 5 milligram kg per kg body weight, then 15 milligram, that means 3 time dose, and the 25 milligram 5 time dose, 10 time dose, 50 milligram per kg body weight. Likewise, different concentration of drug I introduced to different group rats. After 90 days, the animals were sacrificed, then for their hematological, biochemical and histopathological studies conducted. In this study, I used specially liver, kidney, lungs, spleen and intestines were extracted, weighed and stored at 40 centigrade in 10% formalin. Slides were prepared for histopathological studies. These are the histopathological studies. These histopathological slides I took from the high doses treated group, that means 10 times treated group histopathological studies. Now you can see here male kidney slides, and the lungs and the small intestine, spleen, heart and liver. When we compare this histopathological slides with control group, no any significant deformities noticed, because these slides read by an eminent pathologist in University of Colombo, Faculty of Medicine, and the pathologist in University of Herapathdeniya, Faculty of Medicine. Both of them see these histopathological slides and know any abnormalities observed in these histopathological slides, even in kidney, lungs, small intestine, spleen, heart and liver. I observed their food intake. Once a week I recorded their food intake. We didn't observe any abnormal things because they taken their food in usual manner. Water intake also, weekly I observed, and there is no any abnormalities in their water intake. If you can go through these values, you will not see any abnormalities in their water intake. If they are in a ill condition or some unwanted things happens, they are this food intake, water intake will can some different values, can get some different values. You see their body weights. Body weight is normally they gain their weight. I think after completion of the 90 days, they are in a very healthy condition, no any weakness we observed. Here we express our data likewise, and we not see any abnormal things in their body weight, water consumption, and also for their food taken. Then after sacrifice, I weighted their organs. We not observed any abnormal weight gain in their organs, especially if we notice some abnormalities. The abnormalities mean if any toxic effect happen to the organs should be in edematous condition. The organs weight should be increased. If you go through the weight of these organs, we not observed any abnormal weight in their organs. This is the hematological analysis. We collected blood in heparinized tubes, examined using an automated hematology system at a commercial diagnostic laboratory, and these are the results in their full blood count. Total white cell count, neutrophil, lymphocyte, monocyte, eosinophils, basophils, hemoglobin, RBC, this hematocrit and MCHC, we need not show any abnormal values in their hematological parameters also. That means oral consumption of Lokanath Rasa had no undesirable consequence on the circulating blood cell as well as on their productions. This is their serum biochemical analysis. I collected their blood in a sterile tubes without any anticoagulant coating and allowed to stand for 30 minutes, and then samples are centrifuged at 1500 gram for 10 minutes at 4 centigrade, still further processing. Then we done the biochemical testing. These are the biochemical assays: blood urea, serum creatinine, SGOT, SGPT, alkaline phosphatase, and blood sugar. No undesirable consequences on biochemical parameters. After seeing these toxicity study values, my recommendation is when we prepare the mercurial preparations in standard way, we can safely introduce this drug for our human body for different disorders. For further study, actually we done this study for anti-carcinogenic activity on Lokanath Rasa on hepatocellular carcinoma. I think hepatocellular carcinoma is one of the most dangerous and the most commonest carcinoma, especially in Asian countries. Nowadays, we facing many problems because non-alcoholic fatty liver very soon, without any alarming, can convert into a hepatocellular carcinoma. That's why we decide to evaluate the anti-carcinogenic activity of Lokanath Rasa by introducing different doses to the liver cancer cell lines. Here I selected for this study HepG2 cell lines. We purchased it from United Kingdom Cancer Cell Lines Institute, and then we evaluate the effectiveness of Lokanath Rasa. These are the sample was prepared as 20 milligram per milliliter. Cisplatin we use as a standard drug because cisplatin is a very common standard drug for cancers, especially for liver cancers. That's why I used cisplatin 0.1 milligram per milliliter were used as the positive control of the study. These are the results. Then 4 milligram concentration we notice it's having anti-carcinogenic activity, but we know we have to, when we conduct anti-carcinogenic activity by using cell lines, after we determine if having the anti-carcinogenic activity, we have to use this drug on a carcinoma stem line, because the drug should affect on the stem cells. That means it should be a effective drug for cancers. Some drugs can destroy the cancer cells, but if this drug is not potent to destroy the stem cells, the drug will not work. So we have to see how this drug acts on cancer stem cells. That's why now very recently this supervisor of this project is Madam Priyani Parnagama. So Madam advised me to purchase a stem cell line and the liver stem cell line, cancer cell line, to further do the studies to the stem cell line study. So I think for our next research forum, we can see how our drugs act on cancer stem cell line, especially liver cancer cells. And also the further studies, we will do the genotoxicity study by using this cell line. We can do because there are many arguments related with mercury can cause several genes damage. I think it's a very common argument in society. That's why we want to see the genotoxicity of this product, especially the mercurial product, how acts on genes. For this study, I'll do a COMET assay and also for micronucleus assay. By using the COMET assay, we will decide how it acts on our genes, and by using micronucleus assay, we can see how this drug acts and how it will do the DNA breakdown or not. I think it may be a valuable values or the valuable study for not only limited for the Lokanatha rasa, it's only for the whole mercurial preparation. When we consider the safety of our rasa preparation, always we have to practice GMP. Good manufacturing practices are essential to produce quality genuine medicine. And in Rasashastra, especially toxicity and other unwanted things are the concern, always concern. Therefore, this toxicity can happen when we use the improper usage of raw materials. That's why Parnagama Madam emphasized how we select drug by considering the acceptable features. Then, therefore, methods of raw material authentication and standard operating procedures like Shodhana, Jarana, Marana, Amrutikarana are recommended and we have to follow according to our Rasashastra text. And furthermore, quality control parameters of finished products such as Bhashma Pariksha also we have to follow, and then it's also hold in an important place. Finally, I tell also this formulation have specific guidelines for usage such as Patyapatya, dose, Anupana and Kala. So always we have to consider these things, and then we can use a very safe and efficient preparation for our patient without any doubts. Thank you very much for your kind consideration.
Thank you, Professor Herapathdeniya, for this informational session on Rasaushadhi, the safety and efficacy of Ayurveda Rasaushadhi. And we invite you to remain on stage as we have a small token of appreciation, a memento presented by co-chair of today's forum, Dr. S.L. Vebalvala. Doctor, we invite you to present this memento to Professor S.K. M.K. Herapathdeniya. Thank you, madam.